Rickie with me. It's Friday.
Happy Friday.
It's Friday. So we're doing more of these chats kind of with practitioners, kind of sitting down, almost like fireside chats. And today, Georgia, one of our little practice mascots, has decided to join us too in some of the chat. But Rickie, as many of you guys may know, has returned to us just in the last month or so, which we're so pleased. She's going to be joining us on Fridays here on the body contouring suite side of Art of Skin MD, which maybe some of you guys don't know about. We've had it since before the pandemic, and it's really a space devoted to non-invasive body contouring. So we do muscle toning here, we do non-invasive, non-surgical fat reduction, we do skin tightening here, and we do peels over here. So Rickie's background is very diverse. I mean, you've been involved with dermatology and plastic surgery offices for over a decade.
Over the last, 14 years.
Have been involved in some of the clinical studies, which we'll talk about. So we were chatting about like kind of what's topical, what are passions of yours, what are you really amazing at as well, because you've treated me as a patient. Yes. And so we thought we'd maybe talk about kind of muscle toning and non-invasive fat reduction. And the two main technologies that I think do the heavy lifting over on this non-invasive body contouring area is CoolSculpting, which has been around for almost 2 decades now. And then muscle toning technologies using high FEM on the body, which is high intensity focused electrical stimulation, and that's our M-Sculpt machines, either M-Sculpt and M-Sculpt Neo. So maybe grab that old, what is it, 5 or 10 pounds of fat? I think it's 5 pounds of fat.
Yeah, it's 5 pounds of fat.
And, you know, it's pretty unbelievable.
Right? I know. Isn't that amazing?
I think it's a good sort of, you know, it's a discussion piece I have
visual.
probably daily, if not weekly, with patients. Is many patients that we have, we treat men and women, especially women, perimenopausal age. I feel like this just gets attached around our midsection,
abdominal,
and it's very concerning. We lose our waistline, and many of this has to deal with some of the hormonal fluctuations that we're dealing with throughout our life. But there are things we can do to remove some of this redistribution of the fat. And so I perform, you know, minimally invasive tumescent liposculpture, but that has downtime with it, you know, and sometimes that's the right choice for patients. But we also have means of cooling the fat to reduce some of the fat too. So maybe you can talk a little bit, because you've been doing CoolSculpting a long time.
Yes, I definitely have. Yeah, I've had the luxury to become a master in CoolSculpting as well. So I've gone to specific trainings through Allergan at the time. You know, so it's amazing. I have a wealth of knowledge over the years, and like you said, I've done studies with some of the topical treatments as well. So we'll discuss that. But CoolSculpting is an incredible treatment, non-invasive body contouring treatment for fat reduction. So kind of that subcutaneous tissue that we get, you know, I mean, honestly, we can treat multiple pinchable fat.
So like if you're looking at a patient, kind of what is that exam like?
Yeah. So when we assess the patient, I actually have some of the sample applicators here. We have, you know, anywhere from the plus. So this would be a larger area of treatment. So when assessing the patient, obviously, wherever we're treating, if it's the arms, abdomen, inner thighs, basically, like she said, pinchable fat. I literally pinch the fat. I kind of see, what I'm looking for is the peak of the bulge. And that's kind of a funny way to put it, but it really is, you see where that largest amount of fatty tissue is. So sometimes it's angled on the abdomen, sometimes it's just straight across. I mean, everyone's, you know, subcutaneous tissue is different, right? You know, if we've had babies, we're obviously menopausal. It's a stubborn area. You know, my patient this morning, she's like, you know, as I'm getting older, it's harder. I'm dieting, I'm exercising, but it's just this stubborn area. And that's where CoolSculpting comes in. And it's a beautiful thing. So we have anywhere from this plus applicator, and then we have as small as,
and maybe I can stand up, like, I know, you know, so this is intended for people that are on a good diet, good on exercise program, but have areas of resistant dietary fat. You know, tends to be inner thighs.
Yes.
Outer thighs.
Abdomen is
lower,
upper abdomen.
Circumferential, so you can treat flank areas.
You know, raw. This is a very common area. I mean, you're so lean, but like right here where that little area where it kind of sticks out underneath your bra, I mean, you can do the banana roll. You can do you can do arms. Exactly.
And even this little guy,
the little
we've got
pocket
a
that we
teeny
done that with the mini.
applicator.
Actually, I have this right here. Look at this.
So normally that fits where if you're
right here.
on
So
people.
this is your submental area, like right here. She obviously doesn't need it in that area. But some people have that stubborn, which we're doing M-face now too, but that stubborn area tissue. But this thing, Christy and I both have been doing this for a long time.
I haven't done on my left side because my right side is fine, and then I have weirdness right there.
So you can do it
little
right
suction
there.
cup there.
And that's the beautiful thing about these. Like, is there, you know, the petite, this is our smaller one, and then you have, this is kind of like our medium. It's called the Cool Advantage. So this is a tip, usually what people get, you know, depending on the area that they're getting treated. But yeah, there's multiple different areas that you can treat. So it's just upon evaluation, obviously with Christy or myself, and just seeing, you know, going over realistic expectations and, you know, obviously knowing, because you do want them to be somewhat healthy and be working as well. Because
this isn't a diet program.
Exactly.
This isn't an excuse to go to your favorite, like, you know, quart or pint of ice cream and indulge
and
because you're reducing some of this 5 pounds of fat.
Right.
But it really is for those areas that you've worked hard, or just you can see it happens in your family, and we need to address things.
Exactly.
So tell me about like day of the procedure. Like you just had a cool sculpting patient this morning.
Yeah, definitely.
And run me through like what is that day like when they come in the door at Art of Skin MD. So the first thing we do is get photos,
Of course, always.
And then you usher them into, actually not this room, this is primarily like our M sculpt and but we have a lovely other room where we're really lucky we have 2 cool sculpting machines, which means we can treat both sides simultaneously, so that's half the treatment time in certain treatment areas. But tell us a little bit about that process. How do we get the patient hooked up and what's treatment like?
Definitely. So of course, like Dr. Palm said, you come in, we take photos. The photos are amazing because we can see the improvement, do the before and after photos. We bring you into the room. The room is very comfortable. You guys have probably seen it in some of the lives. You know, it's a really comfortable room. Obviously, we situate you in the bed. Of course, I'll always mark you first. So it's called marking the area. So I'll take those applicators and kind of mark exactly where I want to place the applicator. So we do that first and foremost. I mean, we put you in a robe, you know, get you all comfortable because you will be here depending on how many cycles you do for a couple hours.
Yep.
At that point, basically, we prep the area. So we use just kind of like a cool wipe to kind of prep the skin, get it, degrease it, per se. We put a cool gel pad over as well to kind of, basically we're protecting that epidermal layer because we want to be treating that subcutaneous tissue. We don't want to be treating the, you know, the top layer of our skin. So we put that on, and then basically we begin the suction and you apply the applicator.
I mean, it feels like a hickey kind
of,
right?
I mean, it literally just like pulls, I try to, you know, explain to my patients, pulls the tissue in. It's not necessarily uncomfortable. It's just kind of a different feeling. And then what I do like to say, the first 5 to 7 minutes can be a little uncomfortable, but not bad. Just kind of like you have a really cold ice pack on the area, so like a tingling sensation a little bit.
Like a popsicle or something. I've had it done in my lower abdominal area and my inner thighs. And it's funny, like the first 5 to 8 minutes, it feels cold. It's not painful.
No.
And then the area numbs out. And then you're hanging out, and we have lovely TVs in all of our rooms while you're getting these treatment facilities. So you can
Netflix
watch
and chill.
Yes.
While you're getting your sculpted.
You get work done, we got Wi-Fi, whatever you feel like doing. And we make sure you're comfortable.
Absolutely.
And what's an average treatment cycle like lengthwise?
So 35 minutes is the average. So depending on, you know, upon assessment with us, if we can dual sculpt, like a lot of times on the flanks, you can do them at the same time. So that shortens your treatment time. Certain areas we can't do that. So typically I say if you come in for 4 cycles, 4 areas, without dual sculpting, you're going to be here about 2.5 hours. So not terrible, but you are going to spend some time here. So just kind of be aware of that with your schedule and everything. And like Dr. Palm said, it's very comfortable. You know, you watch a movie. We have a little tray that you can have your water and your phone near you. So it's a very comfortable treatment. Once the 35 minutes is over, we remove the applicator and we do a manual massage. So that part too, even my patient this morning, I'm like, this could be a little sensitive, and she's like, I don't even feel it. Like, she was completely numb. So sometimes you can feel, again, a little bit of tingling, but typically you're so numb that you don't feel anything at that point.
And what's happening is we are chilling the fat cells to a point that there's actually crystals in the individual fat cells. So that's what cryolipolysis is. And when we do that, you actually kill a certain percentage of the fat cells. So we think about 15 to 20%.
Yep.
And if we piggyback, which we do with most patients, and see them back for 2 full therapy sessions, usually like 4 to 6 weeks apart, 4 to 8 weeks apart, depending on the area of the face or body that we're doing. You know, you do really piggyback on that. So if you're getting 2 treatment sessions, I think we can approach close to 40% fat reduction in an area. Sometimes even a little more. We'll talk about a way that we actually increase that a little bit. I do, since I've had cool sculpting before, that rewarming, it's the only thing that I don't enjoy for 3 minutes.
Yeah.
And it's more sensitive in some areas. Lower abdomen, I think, tends to be a more sensitive area.
Yeah.
I've heard sometimes a little bit underneath the submental area, underneath the chin.
Sometimes I've done the inner thighs. It's a little
but
little
you literally can
yeah.
put a timer, 3 minutes, and I just do my little happy dance.
Yep.
And then after that, the area is typically just numb for a period of a few weeks. The sensation comes back.
Yeah.
I think one thing we should address is the paradoxical fat hypertrophy, and it got a lot of play in the press because there was a very well-known model that alleged that she had that diagnosis.
Yes.
And that was settled, but I think we get a lot of questions since that got so much play about that. We have not in this office, I mean, knock on wood, seen a case of that.
Yeah.
We think
I've never
the rate
personally I've never personally experienced it with a patient.
That. And what that means is in treating with cool sculpting, there's a paradoxical effect or sort of a swing the other way where we see weeks or months afterwards in the area of treatment fat production or fat hypertrophy in that area. It's extremely rare. We think the case rate is about 1 in 3,000 cases.
Yes.
Like we said, we have not seen it at this facility. It is treatable. So
Absolutely.
we don't know the history of what happened with this model and the treatment afterwards, but you can treat this, and it's usually treated with liposculpture afterwards. And it's most common, most of the case studies, if you look in the literature, are related to very slim men.
Yes.
So if you're wondering, like, are you in a higher risk group for this, typically pretty rare occurrence.
Very rare,
That is a sort of a possible risk factor if you're a very slim male and trying to get, but really if we're going after the right patient, pinchable fat, I think the opportunity for that, yes, it's on our consultation, it's a part of our process, it's part of our consent, but I think the opportunity for that is very, very, very unlikely.
Yeah, very much so.
But it is a permanent form of fat loss, and a lot of times
destroying fat cells.
Patients will ask, well, what happens if I gain weight? And my answer is always, if we've reshaped you and changed your contour, you're going to gain weight in distribution of what that contour is again. So it's not as though all of a sudden you get a fat nose or fat elbow or a fat breast or something. But you should proportionately just gain weight everywhere else because we're working on these areas that are so resistant. We call it gynoid fat distribution areas that in women just tend to retain fat.
In that area.
And so I think it's something that's tried and true. There's been probably over at this point 150 publications on cryolipolysis, meaning cool sculpting in the literature, and it is a very safe procedure for patients, and one that we perform on a daily basis here.
Yeah, Christy and I love it.
I know, and so when we have someone that we think can benefit from both fat loss and muscle toning, which is a lot of patients, typically what we do is we debulk first, whether that's liposculpture with me, cool sculpting with you guys, non-surgically, which is such a popular choice these days because people just don't want the downtime.
Right.
So let's switch gears a little bit and talk about M-Sculpt.
Absolutely.
So we were, I believe that one of the first in San Diego to get M-Sculpt. We were one of the first in California to get M-Sculpt Neo, which combines this muscle toning technology with radiofrequency. So we get the benefits of muscle toning with heating of the fat compartment. So let's talk a little bit like who's a good candidate for that and what is that doing for the body?
Absolutely. So M-Sculpt Neo on the other end does, what do they say, 19% helps with 90% muscle tone, 30% fat reduction. So you are getting a nice amount of fat reduction and muscle tone. But someone who I lean towards M-Sculpt Neo a little more towards is someone with maybe a little bit less like pocketed subcutaneous tissue. You can still obviously have, fat in the area, but someone a little less of that and looking a little bit more towards like muscle toning. If someone's like, Obviously post-pregnancy, diastasis recti. I was actually going to pull a picture of that. When you get pregnant, you can get that separation of the muscles. It helps strengthen those muscles together. Back issues, right? We've discussed that as well. So strengthening that core helps everything in our body.
Yeah.
You need that as your job. So many people in their profession. So if they're looking for fat reduction but also want that muscle toning as well, I would lean more towards this.
Yeah.
So again, it's upon evaluation, assessing the areas. You can do, 10 areas with M-Sculpt Neo, which is absolutely fabulous.
Yeah. And we often will combine it. So we'll have patients, if they have fluffy, pinchable fat, and we need to kind of debulk an area, we'll start with cool sculpting first. And then once we've debulked that fat, then we further reduce that area globally and then build up the muscle. And what's so cool about, I think, M-Sculpt Neo and M-Sculpt is there has been a wealth of publications. I think at this point there's about 30 publications, maybe more, existing in terms of muscle toning and the benefits. And many of these, it's not just simple tape measures and seeing how things are doing, but it's real quality of life measures, and it's also imaging. So we've been involved with 2 of the imaging studies relating to M-Sculpt. We've done the outer hip study and we've done a buttock study, and we did MRIs at baseline and then following treatment, and showed consistently, so you quoted some percentages, but consistently, if you now look at globally over all of these studies, and it doesn't matter the area of treatment, the region of the world or the United States where patients have been treated, or regardless of their BMI within reason, people lose about 25% of their fat, and they gain about 30% of the fat and 25% muscle gain, and so that's pretty amazing. Yeah, and so I think that's remarkable, and this is done independently with imaging, where we can actually measure the decrease in thickness of the fat and the increase in the muscle of the rectus abdominis muscles, or looking at transverse abdominis muscles, which kind of tightens in the corsetting of our waistline. We have so many applications. Like I said, we've been involved in the outer thighs. We can do inner thighs. We can do quads if you're getting ready for ski season. I think I'm probably going to try and do that. And then functionally, we know that there's oppositional muscle groups. So the buttock or gluteus muscle works in opposition with the rectus abdominis muscle. These are 2 huge muscle groups that help with our core strength. And core strength is so important. We lose muscle mass at about a rate of 10% per decade after our 30s. And so
that's crazy.
Really important that we maintain this. It's called sarcopenia. Just like we have osteopenia and osteoporosis with our bones, we have sarcopenia that affects our muscles. So this loss of muscle, over time, if we lose enough muscle, it starts to affect our walking, it affects our gait, it affects our balance, it affects our ability to have a strong pelvic floor. It affects daily activities, and when that starts to happen, it really has an effect on what we call morbidity and mortality. So our quality of life and actual rate of death. And so that's why I think for me, I do a lot of these things, because I have a very active job. I'm leaning over people, you are too. So I treat my abs and I treat my gluteus muscles. Because I'm tall and I have to lean over people to keep a really strong constitution, because I love what I do and I want to continue seeing you guys. And so that's something that I do. And I think we hear, like you referenced, from many patients, they're doing it for aesthetic reasons, to get, a little bit of benefit and see a little better result in swimwear, or in their yoga class or whatever. It makes my yoga class a lot easier. I feel like I'm cheating with my playing.
Absolutely. My workouts from doing it, I feel better. Like, my core feels stronger. I struggle with back pain. I have 2 young children. I'm always holding them. So just having that core strength, again, after having babies and everything, allows my back to feel better. It's amazing.
And we hear that from patients. We hear that their lower back pain is improved. They're able to go back to running or activities that they hadn't been doing in a long time because of discomfort, or just felt like they really needed to sort of be careful about things. And I think that's important. There have been newer studies that have been published that have shown if we can treat this like core to floor, so treating the pelvic muscles, treating the abs, treating the buttock, we can help from sit to stand time in our more mature patients. We can help with, various female gynecological, issues. So, we've seen if we strengthen pelvic floors, that helps with unintentional urination. And we're also helping with just overall strength. And I think that's so important.
Huge.
I care about aesthetics, obviously, but I care more about like the functional life of our patients.
Lifestyle.
And I think that's one of these things, like if you're truly trying to stay active, and many of our patients in Northern County San Diego are, this is one of those things that they reap aesthetic benefits, but they're also getting functional benefits that I think are improving quality of life.
Yes.
So one thing that I wanted to talk about is kind of some of the creams that we use in combination with this, because there's one that you were actually involved when you were at Dr. Marati's, and shout out to Dr. Marati if he's out there. And then we helped with one of the studies. I think you were part of the Cool Sculpting.
Yes. It was Cool Sculpting,
and then we were the M Sculpt.
Yeah.
And what we did is both of us had technologies where we could mirror before and after images together and create a heat map of either volumetric changes, so either kind of weight gain or weight loss in an area basically, or changes in fat and changes in volume over time. And so what we did, Cool Sculpting, and you helped with that study at the time, was treated in the abdominal area at Dr. Marati's office. And on one side, patients applied the topical, this body transform from elastin. On the other side, no treatment, just a barrier cream that was similar vehicle without the actives. And both sides obviously got treatment. And what we found with that study that Rickie was a part of with Dr. Marati for Cool Sculpting, and then when at our site we did M-Sculpt, so treated both sides of the abdomen, but just applied the active on one side, blinded, so didn't know which side.
Yeah, we didn't. The patient didn't.
And then looked at imaging. We found that we could increase the volume loss, so the degree of fat reduction, by 30 to 50%, which sounds insane, but
it does, right?
This has a technology that allows small proteins called peptides to go down the hair follicle, and there is reserves of white adipose tissue. And we can affect that on a molecular layer and help them send messages to some of the deeper fat to say, hey guys, you're unstable and you need
Time
to go. I tell them it's like you walk the plank and like, do you get to turn around or not? And we push them off into the abyss, into the ocean.
Yeah.
So if we have something simple, we can build into a quote that helps patients achieve even a better outcome. And we do know that Trihex technology helps with collagen and elastin, so it's probably going to help with sort of skin texture overall, overall health of the skin. This is part of our standard of care.
Yes, agreed,
right?
100%. Yeah, it's incredible to actually be a part of the studies initially and see. I mean, look at a photo and you can see one side is more improved the other. I mean, it was like I'm like, wow, this is an incredible product, and that was however many years ago, 10 years ago. So. It's amazing.
It's great, and I think we're always looking to what is evidence-based science, not what's on TikTok and not what's on, I know we're doing a social media post, but not what, somebody without a degree and not contributing to the science, and the one on podiums and the one doing the good science. So that's what I think we really look to help with treatment outcomes. In terms of M-Sculpt, it's typically done as a series of 4 to 6 sessions, depending on the person. And then we'd like maintenance therapy. So we've built out some maintenance packages. If you're someone who's done an initial series, we want to make sure you're like quarterly or, whatever
3 to
that
6
time.
months.
Doing a treatment. I mean, that's what I try and do too.
Yes.
When we're not doing a little chat and learn, if I have a free lunch, that's something that I try and squeeze in here at the candy shop. But I think that's important, and the study, a lot of the studies, our endpoints were at 3 months when we saw these changes in muscle and fat reduction. And we know from imaging studies we can actually affect visceral fat too. So when we're training the muscles, it's not a direct effect on that fat that exists behind the abdominal muscle, abdominal wall, and that is protecting our internal organs, but it's the bad fat that has higher risks related to metabolic X syndrome, higher rates of cardiovascular disease. It's the bad fat that we want to try and eliminate. But if we're starting to build muscle and reduce fat with something like M-Sculpt, and oftentimes I think patients just get on a path of healthier sort of eating and living when we start to do some of these changes. But we're changing free fatty acid metabolism, and we're changing muscle metabolism, and that has an indirect effect on visceral fat. So in the imaging studies, when we looked back at some of these previous studies, we saw changes in visceral fat without retreatment. which
That's
is pretty
absolutely
unbelievable. We don't have a way
unbelievable.
even surgically of
To
treating
address that. Yeah.
So I think that's pretty incredible, you know, in terms of an arc of just, I think we're on the edge of sort of regenerative medicine. This is something we can do to truly sort of help your body get back to basics, be in a healthier place, start to change metabolism in a good way. So I think it's really incredible. You know, how can people get a hold of you? So we offer consultations.
Yes.
They are complimentary, which I think is
consultations, yeah.
amazing given your level of expertise. And we've got information and your lovely details on our website
Yes.
at artofskinmd.com. We're on lunch break right now, but typically about 8:30 to 5 p.m. you can call us if it's not lunchtime, Monday through Friday, if you're interested in booking something with Rickie to be
Yes.
evaluated for something non-invasive body contouring wise. And we will definitely be sitting down for more chats
I
with
would
you.
love it. I would love it.
She's amazing, and she's such a wealth of sort of skincare. She's recovering
I know, I'm
from a
peeling.
peel
You
right
probably
now.
can't
So
see
we
this.
should talk about that next time. We'll talk about
We'll
some
do
of the
the eye
peels
peel
we
next
offer.
time. You can see my glowing skin right now. It's peeling.
No, I've been there too, but I think it's great.
It's
I mean,
worth it, I promise.
I welcome it. I think we're refreshingly honest about things because we want to know, like, we just don't, you're a beautiful woman, but you take care of yourself
Yeah,
and do some little
absolutely.
things, and we have a program, and that's what I think we like to
We
talk to
practice
patients
what we
about.
preach. We talk about it, and
Yeah.
we do it. You know,
Yeah.
we take care of ourselves.
And it's
I think
maintenance.
that's huge.
It's
Yeah.
not a huge time invest, but I do think there's a little work up front and then maintenance therapy, whether
Agreed.
we're talking about body or we're talking about skin.
Skin,
So
yeah.
we want to thank you guys for tuning in, and we had a little bonus week. We did this back to back.
I know,
and
right?
we'll do
And
more of
yeah,
these
that's amazing.
fireside chats. So I want to thank Rickie for you being back. We're so
Yes.
happy that
I'm
you're
so
back
happy
along
to be
join
back.
the team
And
along
I
with
missed
Christy.
everyone. Yes.
And she is here on Fridays, so if we know that's a popular day, if you're interested in
Yeah.
scheduling an appointment with her, feel free. You can give us a call or contact us through the website, and we'll see you next time for another fireside chat, okay?
Yeah. All
Bye
right,
guys, have a
bye.
good weekend.